Where do you call it? Good. Okay.
Thank you very much. There are parents who have children going through long COVID around the country, and a lot of parents are finding out that their doctors don't know much about long COVID. There are only about a dozen clinics around the country that specialize in long COVID in kids. What are you doing to help educate doctors around the country so that parents have more resources to treat this?
Yeah, it's a great question, and it's a real problem. Long COVID is a problem that we recognized early as a substantial issue. So let me talk kind of in broad terms, and I'll get much more specific to your question. Back in April, the president tasked the Secretary of HHS to put together an all-of-government response on what are we doing on long COVID, what's our research agenda. Those reports came out in August. We have continued working to try to think about how do we use everything from disability policies to Medicare, Medicaid to make sure we're treating people with long COVID, that we're supporting people with long COVID. NIH is running the RECOVER study, which is it's not a single study, it's a multifaceted approach, building cohorts, trying to develop new treatments and test them. So there's a lot of work happening inside the federal government because this is a really important priority. The problem is that the medical community is learning about long COVID, but long COVID is not a single disease. It's not a single condition. It's probably multiple different things that manifest themselves. So that means that we have to do a lot more research on this. We do have to get out and get more information out to doctors. We recently had a gathering here at the White House of presidents of all the major medical societies where we talked about key things that need to get out to physicians and nurse practitioners. We talked about long COVID as one of those things that we have to educate the physician workforce. So there's a whole set of effort happening both on physician education, but also on generating the evidence and science to actually figure out how we do a better job taking care of people with long COVID.
You get more funding out to those clinics working on long COVID and providing those resources to families going through that.
So there's funding for research that through NIH. We've requested more funding for long COVID work, and I think that's going to be an important part for Congress to step up on. And then if you think about how we fund a lot of these things, we need to make sure, and we're working on this, that Medicare, Medicaid, the other sort of payers are paying for providing care for individuals with long COVID. And, there's a whole bunch of policy stuff that goes into that. We have to have the right codes. We have to actually make sure we can identify people with long COVID. We have to make sure we're reimbursing that care. So there's a ton of policy work that's being done to make sure that we're taking care of, that we identify people with long COVID and we take care of them.
Go ahead, Anita. Thank you so much. Just going back to the funding request, the White House has requested $22 billion. $4 billion of that is for international assistance. Can you just explain from a public health perspective why the American taxpayers should want to spend $4 billion of their money to accelerate response overseas and why it matters for the health of Americans?
Absolutely. Global outbreak, right? You heard today from the president, global health emergency. Therefore, it needs a global response. And that certainly has been our footing in the administration. The U.S. has gotten more vaccines out than any other country in the world. I think about 650 million doses. The problem at this point is not vaccine supply anymore. It is about getting shots in arms. And I'll talk about why it is so important. Every single major variant that has hit the United States has originated from outside the United States. So the notion that we can somehow wall ourselves off and not be affected by what's happening in the rest of the world is just naive. It's just not how transmissible viruses like this work. So even if you think about it from a very narrow self-interest, it's very important that we get much of the world vaccinated, that we help build out the kind of vaccination program. But beyond self-interest, America is a country that has deeply engaged in the world. The president has restored American leadership on global health in a way that was very different than the previous president. And so for a whole set of reasons, it's very, very important that America continue to lead. $4 billion is a small investment to make to better protect Americans and better protect the world.
Thank you, Karine, and thank you, Dr. Jha. Today, President Biden talked about how not enough people were getting boosted. But just a couple weeks ago, you said there are no internal or external goals. There are no targets or numbers that you're aiming for. So what does it mean when he says not enough people are getting boosted? And, related to that, can you give us a picture of if there are any parts of the country that are struggling to boost people more than others, and why?
Yeah, so we, as I said a couple of weeks ago, we don't have internal targets. I think what the president meant was he just wants to see more Americans getting the new COVID vaccine. We all do, right? And that's not because there's a specific target that we're not hitting. It's just that we think it's better for more Americans to get vaccinated. We see, when we look across the country, we see lots of variation across the country on vaccination rates. Again, you can go to the CDC website and see that as well. But our job is that at every part of the country, we need to continue working on improving vaccination numbers. In terms of access, we think there's good access everywhere. With about 95% of Americans live within 5 miles of a place that has a vaccine site. So I don't think that access is an issue in certain regions of the country. About 70,000 sites have a vaccine, vaccinations now. So I think access from a pure kind of physical location point of view is reasonably good everywhere. Obviously, there's some rural areas where we continue to do work to make sure we're getting out to rural clinics. But we need to, I think, continue working on improving vaccinations everywhere.